everyone, and welcome to our session Empowering Oncology Through Nutrition. This session is powered by Espra Nutrition and is being organized by Voice of Healthcare. My name is Dr. Anoushka Amlani, and today, this session, I have Dr. Ghanashyam Biswas. Welcome, sir.
Thank you, Dr. Anushka.
Dr. Ghanashyam is a medical oncologist and an executive director at Sparsh Hospitals in Critical Care, Bhubaneswar. Thank you for being with us today, sir. As we all know, today's session is about nutrition and its importance, especially before patients who are undergoing cancer treatment. My first question for Sir is, Sir, what is the importance of nutrition in general in a healthy body? And knowing that a patient is suffering from cancer and undergoing the treatment, which is not so easy, how does the importance increase? Because that's something that seems to be very important.
So I'll straight away come to the point. So till some time back, so nutrition was important for the patient and the patient relatives. It was not an important for the caregiver like me as an oncologist, and it was a domain for the nutritionist or the dietitian in the hospital. Till sometime this science evolved, I can say in last 1.5 decades or so. So there are certain areas in oncology which were absolutely ignored. So one of them was nutrition in oncology, then psychological aspect in oncology. So this was always an important factor. So every patient asks you, sir, हमको क्या खाने का है? The attendant asks, they are worried about the food, the nutritions. But every time we ignored because we did not give an importance to that. Now we have understood that how nutrition plays an important role in a cancer treatment. So before you start the treatment, while the patient is on treatment, while the patient has completed the treatment. So every phase of a life, so a child is born when the child was in the utero, so the nutrition was important, and the child is a toddler, that's important, and the child grows up. So the nutrition are different aspects in the different parts. So the cancer patient in their journey, the importance of nutrition cannot be ignored because 20% mean 1 out of 5 cancer patients, they don't die of cancer, they don't die of cancer related treatment, but they directly die of nutritional lack. And that's important. That's a red alert and the red flag for all my oncology colleagues that it should be brought into a picture.
Thank you so much, sir. Sir, since you've specified that the 25% of cancer patients who actually die because of lack of nutrition or deficiency there, what is the current status of nutrition like support systems? And also, how do doctors, recommend supplements? And since we all know food is a certain kind of medicine and has a very huge role to play there, so what is your prescription to your patients along with the medicines?
So somebody, now it comes, so once you have diagnosed the patient with a cancer, and particularly some group of cancers, like I belong to an eastern part of the country where head and neck cancers are common, and the head and neck cancer patient usually they go for surgery. Post surgery they have either radiation or chemoradiotherapy, and that's the biggest impact. And this is one cancer where a 5% decrease in a body weight during the treatment can have a direct impact on the survival. Second is a GI cancers. Again, India is a hub for GI cancers, and the same in the eastern part of the country. So, where gallbladder cancer, stomach cancer, colorectal cancers are huge. So, these are cancers. So, all cancers can make an impact, but I'm focusing on head and neck cancers and GI cancers, including a pancreatic cancer, where direct nutrition can make a big impact in terms of losing weight, in terms of delaying your standard therapies, and prolonged hospitalization, and then catching hold of all opportunistic infections which is directly related to nutrition. And India being a hub for a 30-40% of our patient population are diabetic, and then the whole situation gets more complicated. So
Yes,
till
definitely.
traditional, till some time back, our patients were on some sort of in the protein supplements by the dietitian and add back home. So if they are from a rural background, so they have some homemade, and once they are into the urban population, so they have some commercial prepared. But probably there was much lacking of science still some time back. Few of the organizations who focused more on nutrition, so I can say handful of organizations now, at least 4 5, who are focusing on nutrition and has brought out a bigger change. And we see that. So in my 24 years of oncology, I've seen that change from understanding and giving importance of oncology, eh, and especially nutrition, and that has come a big way, I think. So more and more, with more and more time, we'll see more focus into these aspects.
Sure, sir. So, since nutrition again is a very personalized, it can't be same for everyone. Everybody has different nutrition needs, and like you said, like India has a lot of cases of GI cancer, pancreatic cancer, and head and neck cancer. So, has there any been a streamline of nutritional or a diet plan that usually a doctor hands over to the patients for any particular specific kind of cancer, or in general to cancer patients, like something rich in antioxidants or something like that?
So for our viewers, that once we are talking about nutrition or a cancer nutrition, that doesn't mean only a starvation. That doesn't mean the losing of weight. So on the other hand, in the many parts of the world, and even many of our patient population, they are overweight. They have a high body mass index. So we should not forget that part also, because we are talking about nutrition. So obesity, high body mass index has to be brought into picture, not only cachexia, anorexia. So that's it, because there are many cancers. I'll say you just a name. So now today in the world, the most common cancer is males, females both together, is a breast cancer. So premenopausal breast cancers today, one of the common factor is an obesity. There are many cancers in the liver known as hepatocellular cancers. So hepatitis has come down. So why there is an incident surge of hepatocellular cancer? Because of increased body mass index. So there are cancers of uterus in the females, endometrial cancers, pancreatic cancer, bladder cancer, which are directly related to obesity. So on the other hand, we are talking about cachexia, starvation, weight loss. So on the other hand, so we should give importance to both of these. So now, if the patients had a high body mass index, so that the formula, the plan of treatment is different. If somebody is, so once this patient comes to you, so suppose I'm talking about a head and neck cancer. So this patient is diagnosed with a cancer. Tomorrow you are not going to plan for the surgery. So you do a routine blood markers, you do a cardio checkup and everything, and then put your patients on some nutritions. So we talk about, there are organizations in, even in the Aspire we have, there are something called Invigor, so or the Nourish, so where the patient are put on 7 to 10 days before they are actually subjected for surgery. So this is becoming important, and different phase of the treatment, so you put them on different things and then you see the result. So if somebody has an obesity, so there are other problems, so you take care of their nutrition in a different way. So you have to plan the chart of their fooding, and then there is a subjective global assessment. So you put your patients in A, B, or C, and then accordingly you plan how many days prior to surgery or how many days prior to chemotherapy, so you plan your treatment.
Very rightly said, sir. So I think what I can understand from your input is that the nutrition part is very interrelated to the lifestyle as well, and that takes a toll on the treatment plan and is very specific to different patients. But so we also know that in general, cancer patients have immunity issues as well. So to support the immune function, are there any particular foods or dietary patterns that are specifically recommended to patients suffering from cancer?
So once you talk about nutrition, so it is not only a carbohydrate, it is not only fat, it is not only a protein. So now the most important thing, there are many elderly patients. So where soluble fats, the fibers are important, because many of these patients have a constipation. Many will have treatment related diarrhea. So one is a soluble fibers are important. To balance the gut, you need a microflora. So you need to supplement with a microbiota. And today microbiota, which are basically synergism microbiomes in your gut, in the GI system, which actually helps you fight against the disease itself, like colorectal cancer is proven. Now we do a fecal transplant for a patient, somebody who is a fecal transplant with a good amount of microbiota, they are going to do good as compared to who has a bad microbiota. So that's important. So soluble fibers which regulates your bowel, good amount of microbiomes that improves your treatment related protocol. Now, so besides this, we have branch chain amino acids. So that is important. Then L-glutamines, which are micronutrients. Like, so there are n number of micronutrients, and so starting from sodium, starting from potassium, calcium, magnesium, zinc. We have seen the importance of zinc during the COVID time. So everyone XYZ in the country was taking iron and zinc. We have seen in pediatric age groups, so those who have chronic cough, chronic regular fevers, so they are put into zinc. So normally in practice in adults we don't do that, but that's important. So these are all micronutrients which needs to be replenished at time to time. So they have their own levels, and unless and until these micronutrients are taken care of along with omega-3 fatty acids, so these are certain important things we miss during. So once somebody is offered a protein a pack or something on commercially available, so as an oncologist, as a doctor, as a physician, we need to see how these things are added into that supplement. So that's important.
So I think I'll go back to a question that you answered a few minutes back, and something you just mentioned about pediatric patients needing zinc and other micronutrients. So could you throw some light and about what kind of age group requires a certain kind of micro supplement, and what's the difference between pediatric patients and elderly, and also does it vary from different like gender wise as well?
So pediatric, though I have stopped treating pediatric some time back now. So pediatric is difficult to handle, and we know that. So our children are grown, so they have a different taste. So they need a different look of those nutrition. So unless and until the child is a patient who is on a Riles tube, then probably you can prepare those. Otherwise, every child, a healthy child even is supplemented with zinc, so that's important. So everybody should be supplemented with vitamin D, because, and we have understood that during the COVID, so somebody who has a high vitamin D, so their chances of immune reconstruction is much more important. So normally healthy individuals have something around 25, 20 to 25, that is the units of vitamin D in the body. But a cancer patients on treatment, especially cancers of breast, especially cancers of ovary, colorectal cancers, where vitamin D's are normally kept more than 70, so on a higher side, because that helps. So these are many times ignored, but that has shown that. So you cannot have a bigger trials on this, because these are all nutrients, so that helps you cope up with the treatment.
So, like you rightly said, it's very difficult to convince pediatric patients because they have a lot of taste issues and choices. They can be adamant about it as well. So, what is the patient acceptance when it comes to nutrition, like the prescription the doctor prescribes? And also, since a lot of over the counter supplements are available, and there's a lot of information on the internet already about what should be taken and what should not be taken, how do doctors overcome this issue?
So I think so. The first thing is that we as a community, the treating physicians, or the surgeon or a radiation oncologist, because these are all different departments in a oncology. So patient journey goes through these departments along with the supportive departments of nutrition. So I think so. Once the treating doctor gets convinced about the oncology and the nutrition, how important it is, and that is the first hitch. So since many of us are so focused on the treatment, we actually forget the nutrition part. So
Yes.
unless and until we imbibe those virtues in us, so it cannot be percolated down. So once we are convinced, then the second part is that we need to convince the patient's caregiver. So patient's caregiver can be patient's wife, it can be his mother, it can be their children's, and one then it goes to the patient directly. So I can think, so there are three levels. So from the treating physician, doctor, and the patient's caregivers, attendants, and then the patient themselves. And fourth is, so once you are in an institute or an organization, so your departments of starting from the cafeteria, restaurant, and the dietitian or the nutritionist, so all four put together, so you need to talk on the same line and length. So if I talk about something of a omega-3 fatty acid and a micronutrient, and the other guy comes in and writes a prescription, so that should not vary much. So once we talk about the same thing on a line and length, so there is a uniform display of science, and then the patient gets convinced. Yeah, so comes there because many patients are insured. So once you talk about a commercially available, so many a times these insurance companies, they don't allow, or they don't insure this company, this the proteins, because it usually happens. So there are certain things. So you talk about a hand gloves, you talk about a mask during COVID, or this protein supplement, so this doesn't get covered. So people though find an interesting or the importance of that, but they don't want to go out of pocket for a 1000 rupees or a 1200 rupees of a 7 days 10 days pack. So that's important. So suppose you are giving it free, so they will take it. So there are hitches for those points, because unless and until you make them convinced that this is an important part of the treatment ongoing, and its pros and cons, and then definitely many will take. So definitely not 100%. I think three-fourth of the patient, three-fourth out of three out of four patients will definitely vouch for that.
Thank you, sir. I think you very easily communicated the role of effective communication and proper channels that actually help the families accept the line of treatment. My next question to you is, sir, like you said, there are a lot of cost issues. How do patients overcome those in terms of not only acquiring information but actually going and buying those, nutritional food items? And also, since nutrition is a very interesting element, a lot of micronutrients and vitamins, they kind of their absorption kind of is varies. And how do doctors interpret that and personalize the nutrition plan for that particular patient?
So most of the cancer patient, especially during the treatment part, so it is the whole science is, it is a catabolic process. So there is a breakdown process. So if it is associated with a weight loss, then definitely carbohydrate come into picture. So there is nothing like you stay away from carbohydrate, because you need an energy. So, but the protein requirement is high for a growing child, high for a mother carrying a child, so high for somebody who is going for a cancer treatment. So, the normal requirement of a protein per day is lesser than what these patients require. So, definitely that part has to be taken care of. Secondly, is that many patients may not be able to purchase, as you rightly said, commercially. So, like in my institute, so my dietitian is a very honest person. She has been refining her own ways of preparing, and now you know that India is probably the largest producer of millets. So, ragi comes in a good way for all our cancer patients. So that is rich, so rich, and that doesn't cost much. So we can make food paste like, so we can make some sort of syrup like, or juices, so like lassi, and so all those different formulations putting in millets, and that gives you a lot of. So these are certain cost saving, or probably at a much cheaper, which can be prepared at home or the hospital. So I think so that's the way we have been doing for last 2 years or so, and that has make a big impact for those patients who may not be able to purchase those commercially available costly, or those formalized nutrients.
Thank you. So it's good to know how your team is using millets and advocating its importance and benefits. So, cancer patients go through a lot of side effects during the treatment from chemotherapy, and that might also lead to the reaction of not wanting to eat, loss of appetite. So, in those cases, how does nutrition and what kind of nutrition plays a better role in enhancing their recovery and also gaining appetite?
So there are many cytotoxics. So I'm talking about the truly cancer medicines which are cytotoxics, which doesn't differentiate between a cancers and a normal cells. You get a loss of hair, you get a discoloration, so you lose your taste buds, so you have a bowel abnormality. So you need to see the iron status. So now, so this is a customary for all medical oncologists putting your patients on a cancer chemotherapy. So you look at the, because still our about 40-50% patients come from a rural background. So still the whole country has not even have a structured toilet. So we are vouching for that, but still, so when many comes to you the hookworm infection, so you are treating a cancer, so where there is a iron deficient, so these patients are going to do bad regarding a quality of life. So they are in a treatment related fatigue, and so these are patients who won't have a productive, somebody is working in office, or somebody has been assigned some job, because of fatigue, because of anemia, they won't be able to. So you need to look at the baseline iron, so you need to supplement either orally or injectable. So many patients, especially our Marwadi friends who are mainly vegetarians, so we have seen lots of them have a low vitamin B12, and that's how they are anemic. So they never thought of, and ultimately you supplement them with vitamin B12 for 2 injection, 3 injection, and suddenly you'll see their faces are red. So these are certain things. So vitamin D, folic acid, vitamin B12, and then these are and the iron. So besides this, there are many. So it is a summertime. So coconut water, if you get a coconut water, which is you can really afford it today, they are becoming more costlier. So I think these are, so that is a rich source of potassium. So it's time for many of the fruits. So lemons are there, guava is there. So these are patients which are rich in calcium, potassium. So these are more important, and then taking more of coffee and tea during the summer. So rather you supplement, you prepare the ORS with the lemon, so with salt and some amount of sugar, just to make it more palatable. So these are, and the ORS today you can see, so those are prepared and available. So I think these are different ways, so one can hydrate, especially in summer, because our cancer patients on chemotherapy, they have severe GI issues, especially hyponatremia. Patient comes with a confusion, do a serum sodium of 110. Many of these lands up in ICU. You put them on a hypertonic saline, and if the hypertonic saline really is not monitored properly, so there can be a permanent brain damage also. So lots of patients, besides hyponatremia, they comes with hypokalemia. They have lots of diarrhea, and you see they come with a paraplegia. So they come to the absolutely, and you do a potassium has come as too. So these electrolytes are very common during the summer, and then also during the flood. Then there is a heavy rains. So these are certain things which should not be ignored while the patient is either a curative intent or even with the palliative chemotherapy, because that takes away your quality of life, that takes away of the quantity of life of a patient, especially who are of a curative intent. So if you lose a patient on a curative intent, so who is just on the sixth cycle of chemotherapy, last cycle, and lose because of a dyslipidemia or because of renal failure, after a bout of diarrhea and vomiting. So these are very painful for the family also, and for a treating physician, that you try to save one patient and lose because we could not manage, or we could not convince, or we have probably could not counsel them properly about the chemotherapy related toxicities.
Thank you, sir. Thank you for speaking in detail about the intervening aspects of diabetes, anemia, and other management when it comes to nutrition and oncology. Moving forward, before we wrap up today's session, I would like to pick up a few questions from our audience. So, how can a balanced diet improve the effectiveness of cancer treatments? And adding to that, once a patient is healed, what kind of a diet will help patient to not have a secondary cancer develop? Like, what kind of lifestyle and in terms of nutrition changes can a patient make?
So for all cancer patients and their families, the most important is that, as far as possible, don't introduce a foreign diet. So give a diet which the patient has been taking for last 30-40 years. So don't try to introduce something which was never taken by a patient. So the patient mother was preparing, the patient's wife was preparing. So I think so that's the way. So it has to be so much usual that I'm on those foods which I've been taking for so many years. The foreign food or the foreign foods, I mean that somebody someone has never taken it and tried to, and you land up in a problem. So balanced diet is that, so if you are losing weight, so definitely carbohydrate is important. So when you had a cancer or on treatment, don't think that I won't want to so my weight will I'll gain weight. So this is not the time that you think about those. So don't try to analyze those in those parts. So as far as possible, so the amount of carbohydrates that has been advised, the amount of fat, the amount of proteins, and the soluble fibers, so all are important. And along with that, the hydration part, so 3 liters, 4 liters, and during especially the summer, so this is very important, except for those who has a renal failure, except for those who have a severe cardiac issues where these are fluid restrictions. Otherwise, the normal patients, normal individuals without these baseline comorbidities, so they should have adequate amount of liquid. So hydrotherapy is so important. We should not underestimate. So there are many parts in the country and the world. So water is going away. So but hydrotherapy and water is so important. So and this is priceless, and so nobody understands the importance. So like there is a saying, so we have seen water in the sea, so our probably our next generation will see water in a capsule. So that's the situation in many parts. So if you go to
Yeah.
Jaipur, you go to down south to Chennai, so there is such a scarcity. So maybe in next few years you won't get water for drinking water. So everybody will be on a bottled water. So don't underestimate the power of a common man. He says Sarukh Khan. So that's the power of a water. So a healthy water, even adequately taken. No? So even during starvation, so people can live on only water for. So that's the power of a crystal clear and a colorless water. So we should not underestimate that.
Thank you so much, sir, for very nicely mentioning about the Indianized foods that our patients can consume and also the importance of water. I have one last question for you, which is regarding what are the misconceptions of nutrition, like about diet, that you usually come across in your patients, and how does it vary from rural patients to urban patients?
So one of the misconceptions is that you should not give a non-vegetarian diet. Somebody who has really grown up with a non-vegetarian diet and tried to change into because now you want to be more spiritual and you want to be that I'm on a vegan diet now. So this is not the time to experiment. So as I said, so you be on a regular diet. So there can be some amount of moderation, right? So you are eating a non-veg with lots of spice, so that's not the right maybe, because spice itself can cause lots of GI toxicities, and again you don't want I don't want my patient to be into trouble because of GI toxicity lands up. So it can be in the form of soup. It can, so you can always revolutionize at home. So your mother, your wife, always your sister can always do that. So that's important. Second is that, so whenever possible, so this is a time, summer time, so you carry your water, so you don't take those fruits not washed properly. So in an ideal situation, you need to clean those with the potassium permanganate, because most of these fruits today, unless and until you buy from, so these are all color, artificial colors. So wherever possible, so I understand that is not possible always, but if possible, at least try to clean those properly. And probably these colors, added colors, are probably adding more cancers to our population. So why the cancer incidence has come? So lots of lots of chemicals using in the paddies. In my state also, there are districts which are using, and it is a huge dearth of cancer. You go to Punjab again, so lots of for the pollens, for the paddies, you using lots of and that's the reason for that you're getting certain common types of cancer, especially the GI cancers. So I think so these has to be kept in mind for a healthy life.
Thank you so much, sir. Thank you for your valuable time today. I request you to kindly give a message for all our viewers who are watching you today.
So thank you for joining this late evening, I can say. So for those cancer patients and their relatives, so put them on a diet which they are comfortable, which you are comfortable in preparing at home, if possible. So there are different diet schedules, there are nutritional statements now, and so there are different guidelines from where we have picked up. So there are pharmaceutical companies who have really focused on nutritional aspects of different phases of cancer. So you can always, either you can go through, or you meet a dietitian, or you meet your oncologist, and always ask for that. So don't shy away from asking these questions. So this may look silly to you, but today our oncologists have waken up. So I think, so that's important. So he will be not only prescribing, so what is precision oncology, so he'll be a precision nutrition. So that's the importance. So nutrition is now precision. So you should not forget that nutrition is not an integral part. So you also think as an integral part, then, because we understood that there is a precision nutrition aspect when we are talking about a precision oncology too.
Thank you so much, sir. On behalf of Voice of Healthcare, I once again thank Dr. Ghanashyam for his valuable insights. Thank you so much, sir. And I thank all our viewers for joining us today. Thank you. Have an
Thank
amazing
you,
rest of
Madam
your day.
Indra. Yes.
Thank you.
See you.